Well, there might be some more people joining us, but I think we'll get started. It's a little bit after 7. So hello, everybody, and welcome. My name is Polly Mendoza, and on behalf of the staff and volunteers at AARP Massachusetts, I welcome all of you who have joined us from around the country, not just Massachusetts, today for our Prepare 2 and 4 Care webinar, which is brought to you by AARP. 65 years ago, the American Association of Retired Persons was founded by a retired high school principal, Dr. Ethel Percy Andrus. What's important to know is that with so many of our members still in the workforce, we are no longer called the American Association of Retired Persons. We're simply AARP. AARP strengthens communities and advocates for what matters most to more than 100 million Americans 50 plus and their families, which is health security, financial stability, and personal fulfillment. AARP is always focused on supporting caregivers and the people that they care for. November is National Caregivers Month, and throughout the month, we're offering caregiving webinars every Thursday except for Thanksgiving. Next week, we have Making Sense of Caregiving Costs on the 16th from 7 to 8 p.m. And then we have Downsizing and Decluttering on Thursday, November 30th from 7 to 8 p.m. And in a little bit, I will put the links to our events and make them available to you. AARP is fighting for America's over 48 million family caregivers who help seniors live independently in their homes instead of being forced into nursing homes. Family caregivers need common sense solutions that will save them time and money and provide them with more support. We maintain a deep focus on the support for caregivers, and you'll find that reflected in our offerings, in our resources, and in our advocacy. Defining family caregivers is an important first step before we get started with the webinar today. Every day, family caregivers assist their older parents, spouses, siblings, grandparents, and other loved ones so they can live independently in their homes where they want to be. That is a caregiver. They help with everything, including medications and medical care, meals, bathing and dressing, chores, finances, grocery shopping, transportation, and much more. Some family caregivers help a few hours a month while others are on call 24/7. Many family caregivers work full or part-time, and some are also caring for their children. With Veterans Day being this Saturday, I also wanted to touch upon caregivers of veterans. When you're a caregiver of a U.S. veteran, you start younger and care longer. These dedicated caregivers provide $14 billion worth of unpaid labor each year, managing medications, preparing meals, helping with bathing, feeding, dressing, providing transportation, among other care tasks. And according to AARP research, military caregivers far outspend non-veteran caregivers in one category in particular, which is personal expenses, and that includes paid help. AARP is advocating across the state and all the way to the U.S. Capitol to support caregivers, protect Medicare, Social Security, and the financial security of caregivers. Last year, AARP led the fight to low prescription drug prices in Medicare, and we won. Millions of older Americans are now starting to save money on their medications. We ask you to bookmark the AARP Massachusetts page to keep up on all the advocacy milestones we achieve in collaboration with our volunteers and members. The website is www.aarp.org/MA. To keep up with us further, please follow us on social media as well. And we want to count on you as one of our thousands of followers and fans online. We post about all of our events, our wins, and our calls to action. During today's program, if you'd like to ask a question, click on the Q&A button and type in your question. And if you want to see the transcript, you can click on the CC at the bottom right of your screen and turn on the closed captions. After today, the recording will be sent to you along with all of the slides. And then we have one call of action to you that we ask you for your help, and that is in sharing your caregiving story with us. We're collecting stories over the next few months, and we'd love to hear yours. I will include a link in the chat where you can share your story with our communications team. And in doing so, you'll actually be helping other caregivers across the country who might be encountering similar situations as you are. And without further ado, I'd like to introduce you to our speaker for the evening, Teresa Chaklos. Teresa began volunteering with AARP Massachusetts in September of 2020 She retired from the District of Columbia Superior Court in October 2019 after working there for 10 years as a family law facilitator in the Family Court Self-Help Center. Teresa has a Juris Doctorate from Regent University School of Law and a Bachelor of Science in Criminal Justice from Northeastern University. She is certified as a mediator and in group facilitation. Her professional background is diverse, but always focused on work that serves to empower others. Teresa's passion for caregiving stems from her personal struggle with having to establish care for herself when diagnosed with cancer in 2014 and having to navigate recuperation and movement after 2 major surgeries. Being part of the AARP Massachusetts Speaker Bureau allows Teresa to continue to empower others by giving presentations that are filled with important and useful information like what you're about to hear. Teresa, welcome.
Thanks, Polly. Hi, everyone. I'm so happy to be here with all of you. And I saw in the chat, there's somebody from my old stomping grounds in Arlington, Virginia. So welcome to you, especially, and everybody else from around the state. So this presentation is all about supporting one another. We will invite you to share your ideas, ask questions, and connect with other caregivers and care receivers, people just like you. So before we begin, just a couple of ground rules. Try to place your questions in the Q&A, and if you can, try to save them until the end. But the Q&A is there so that if you need it, so you don't forget about it, we'll have it, and Polly will tell me about it later. It's a judgment-free zone, so there are no silly questions or questions that seem insignificant. If you feel the need to ask it, go right ahead. So when it comes to caring for a loved one or recognizing that we ourselves might need care, most of us don't have a plan until a problem or a crisis emerges. People can now expect to live 20 to 30 years beyond the traditional retirement age of 65. Now more than ever, it's important to prepare for the future so you can be prepared for and or meet the needs of caregiving. Let's see if my slides will work. So during this session, we're going to share a framework to help you make plans about care for family members, neighbors, friends, and yourself. And hopefully after the presentation, you'll feel comfortable enough to connect with other people, exchange tips and advice, and explore available care resources. Now, as Polly told you, I'm not currently a caregiver, but I did have to quickly develop a team to help me when I was diagnosed with breast cancer and facing not only surgery, but aggressive chemotherapy for 5 months. Throughout that experience, I developed a unique perspective which connects with the practicality and the difficulty in allowing others to help and take over certain tasks. At the time, I lived alone, I worked full-time, and I thought I was quite independent. It was tough to admit that I was going to need help. And as it turned out, I needed help again as I had to undergo spinal surgery less than a year after completing chemotherapy. So to help you get a picture of today's caregiver, let me ask you a few questions. And if any of the following is true for you, if you're able to use the reaction feature or maybe wave your hands at the screen or put something in the Q&A, that would be great. So have any of you ever helped somebody with household tasks such as cleaning, laundry, or yard work? Have you helped someone with medications or regularly cooked or provided food to another? Have you ever driven someone to doctor's appointments or made shopping trips or run other errands? Or provided personal care such as bathing or dressing, or helped somebody with finances or paying bills? Seeing yourself in any of those scenarios lets you know that caregivers are all of us. in so many ways that often seem small and insignificant, such as just calling somebody to say hello or keeping in touch with family and friends by dropping by or something like that. In all those seemingly small gestures, we are all caregivers. So today we're going to share some practical information to help you as you seek or begin to provide care, while also best caring for yourself. And regarding the quote you see here on the screen from our founder, Dr. Ethel Percy Andrus, I believe it implies that when we give to others, especially our own time and talent, it fulfills in us our own need to be needed and to be useful. And that is a great feeling indeed. So, if you saw yourself in any of those questions I asked before, do you also sometimes feel like this? Like you're juggling a whole lot? So, in order to try to help that juggling down to a minimum, we're going to break it down into 5 steps: starting the conversation, forming a team, making a plan, finding support, and caring for yourself. So step 1 is starting the conversation. Often, we avoid discussions about the future simply because we don't want to think about changes in our lives or the lives of the people we love the most. We wait until a crisis occurs before talking about our values and preferences, our wishes for healthcare, or details about finances. It's never easy to bring up what you think will be an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk before a crisis occurs. It's easy to put off these conversations because they can be difficult, and we're busy. But you may be surprised to find out that your loved one has been meaning to have the talk also. So before you start the conversation, here are a couple things to consider. Look for an opening. When raising the topic of future care, you might find it helpful to reference an article you just read or something you saw on the news to break the ice. For example, saying something like, "I just read an article about gathering all your important papers. Sometime, can you tell me where your important papers are and what you'd like to be done just in case?" Respect your loved one's wishes by trying not to anticipate what you think they might say or how they might react. Just get the conversation started. Be open, express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time. Reviewing finances is another important thing to do, as money can be a particularly difficult subject to talk about, but is often at the heart of many decisions you'll make. Housing costs, healthcare, and other expenses such as groceries, medications, transportations are some of the financial pieces to consider. Ask your loved one to review their bank accounts, investments, insurance, coverage, and other relevant finances, assets, or income that can be used to cover these costs. Find out whether they have long-term care insurance should they need it. To help you with this task, AARP has created the AARP Caregiving Financial Workbook, a practical guide focused on health, housing, and money management for caregivers. Each set of worksheets is designed for caregivers to capture the essential information they need to manage the complex responsibilities of caregiving. There's also a workbook available specific to veteran and military family caregivers, as well as versions in additional languages. You may find that your loved one's initial response to your attempt to start the conversation is something like, "I just don't want to talk about it." Keep in mind that some people are private by nature, and sometimes it's difficult for someone to admit they need help. And as a result, you may encounter some resistance. And for those of us seeking help, know that our loved ones may have a hard time accepting that we are reaching the point of needing help, especially in situations where we're still working full time. If your first conversation doesn't go well, try again. And if you're still running into difficulty, try asking a trusted family friend, doctor, or faith leader to share your concerns. So step 2 is forming your team. Then take a close look at the picture you see here. It's clear that the discussion could include multiple generations, such as our children, grandchildren, as well as a spouse or partner. Now, it seems a no-brainer to look for team members who live nearby. Proximity does have its advantages, such as the ability to stop by or drive to a doctor's appointment or prepare a meal. But let's not forget that just because someone doesn't live nearby or have huge blocks of free time doesn't mean they can't pitch in. Family or friends living at a distance can help with tasks like coordinating meals, bill paying, or financial assistance, especially those who are technologically talented. Don't be hesitant to ask others for help, even if what you think might be a small task. Some people may only need a little encouragement to take on a simple task and are glad to do so when you ask. Now, in building and supporting your team, first determine the number of team members. So both quantity and quality, should be thought about because they're important when building your team. And while having a large caregiving team can be helpful, the old saying, too many cooks spoil the broth, comes to mind. So make sure everyone on the team is clear about their responsibilities, and they should be supportive and willing to lend a hand. In assigning roles and responsibilities, understand that everybody has something to contribute. Play to each person's strengths and be clear on what's needed and expected. Now, focusing on the care recipient, this is important for those of us who are seeking care because the key and often overlooked person in the conversation is the person who needs care. For those of us seeking care, barring any mental or physical incapacity or other extraordinary circumstance, you are able to play a significant role in determining who should be on the team and what needs to be done. This is the time to put your needs first. Step 3 is making a plan. The plan doesn't have to be extensive or fancy, as you can never anticipate every detail or scenario, but the plan should include immediate needs as well as plans for when the situation evolves. In my situation, I made a chart and I put on it what type of help I thought I would need, such as rides to appointments, grocery shopping, house cleaning, and I emailed it to everyone who said to me upon learning my diagnosis, "If you need anything, let me know." This enabled what became members of Terry's team to schedule themselves at a time convenient for them and to complete a task they were comfortable with and able to complete. I learned that we often wish we could help when we learn that a friend, a colleague, or a neighbor needs care, but we get stuck trying to figure out how we can help. And the folks who helped me actually thanked me for letting them know specific ways they could help and for allowing them to help. So in formulating any questions or comments for later on, perhaps think about what you might do differently to form your own plan. So no matter where you are in the journey of caregiving or care receiving, just beginning to anticipate a need or helping to coordinate a big move or taking care of someone full time, having a good framework to help guide both you and your loved one will make the process easier. So now that you have a team filled with willing caregivers, it's time to start building out a plan and designating responsibilities. Always make sure your plans are being made with the person you're caring for at the center of the discussion. So first, hold a team meeting. This is one way to get things organized and ensure that the team members are on the same page when it comes to making and sticking to the plan. If necessary, use your computer-savvy friends to assist you with setting up the meeting. The meeting may take place face-to-face, over a conference call, Zoom, or through a series of emails. Determine what works best for you. Excuse me 1 minute, please. Okay, I'm back. So assess the goals and needs of your caregiving plan. And remember, it doesn't have to be extensive or fancy, as you can't anticipate every single detail or scenario. Just try to include immediate needs and broader plans for the future. The caregiving guide offers an assessment of goals and needs. And so after you determine your goals, delegate responsibilities. It's time to figure out who will do what. Some additional tips include that the person who will receive the care should play a significant role in talking about and assigning roles and tasks to the extent possible that they're able to do so. For example, even if one team member is an accountant, the person who will receive the care may feel more comfortable having somebody else handle their financial affairs. Communicate. Try to keep everyone informed as things change. Make sure there are no surprises or hurt feelings. Remember, continued communication is a key element throughout the care, receiving, and caregiving process. So at one point, I had 5 pints of Ben & Jerry's Tonito ice cream in my freezer because my team members knew it was something I liked, but they didn't realize how many other members were also buying it and dropping it off to my house. Thank goodness I had room in my freezer. Now, I would also receive texts a lot of times from helpers who just happened to be at a store like Target or Chick-fil-A or Whole Foods, wanting to know if I needed anything. They knew that after sort of my first round of chemo, I dropped 15 pounds in less than a week, and that is no way to diet. So they were trying to help me with things that I was either craving, or if I had mentioned, oh, yeah, I did have a little ice cream today, and oh, it was so good. And so they just would start buying things. So great intentions, but like I said, thank goodness I had room to store all that ice cream. Those of us who are receiving care, you should let your caregivers know when you're having a good day or a bad day, and that will help them know whether they should reach out to you, come by, call, or just give you time to rest. Make sure you determine what tasks everyone is comfortable performing, and also be sure to ask your team members about their preferences. It was surprising to me how many people were willing to come to my home and vacuum, clean my house when they had hired help for their own house cleaning needs at their own homes. One team member should take notes and write a brief summary of what was decided. A written summary of the plan helps ensure that the wishes and needs of who you will provide care for have been considered and included. In my situation, once that chart I sent out was completed, I emailed the final version to everybody so that each person knew that there was someone helping me on a given day. Step 4 is finding support. If you've come to realize that the scope of care needed is beyond what you or your team can provide, it's okay to reach out for extra support, and there are a number of ways you can obtain the help you need. Locate community resources. Your local agency on aging or council on aging can help connect you to a variety of services such as home delivered meals, transportation, adult daycare, care management, and more. They can also answer questions about which resources are free and which may have a cost. You can also check into services offered in your community through the resources section in the caregiving guide. Also, the Elder Care Locator is a public service of the U.S. Administration on Aging. It connects caregivers to local services and support. And any of the resources I mentioned are in the caregiving guide. The Elder Care Locator can be found at eldercare.acl.gov. Consult a professional. A trained social worker or nurse can help you sort things out, determine what's needed, find services, and arrange care. Here are some of the most common needs. Hiring help. If you see that your loved one needs help with daily activities, try exploring home care options. Some home care workers do household tasks, such as cleaning and meal preparation, while others do more personal care tasks, such as bathing or dressing. Your local agency on aging can help you identify and connect with the appropriate services. And you can also go online and visit AARP's Caregiving Resource Center at aarp.org/caregiving for more information. Secure the safety of your loved one. Help them be safe and comfortable in their home. Try incorporating handrails, grab bars, night lights, or adjustable shower seats. Some things, such as installing grab bars, may be best left to a professional. So you can also check out AARP's Home Fit Guide at aarp.org/homefit for a range of solutions. I encourage you to write down the website aarp.org/homefit. The guide provides tips, suggestions, worksheets, and resources to make a home a lifelong home. In exploring housing options, there are a variety with supportive services that might be available in your community. Begin by making a list of criteria such as location, group dining, laundry service, and more. Once you determine the criteria you need, visit several facilities and be sure to talk to residents and their families. Support groups can also be helpful in navigating available resources. AARP has a Facebook group for caregivers, as well as online message boards on aarp.org. You can visit aarp.org/caregiving and click on Community to get connected to the online message group. Remember, the Caregiving Guide has many resources listed for review at your convenience. For more information on housing options, go online and visit AARP's Caregiving Resource Center, and the web address is on the back cover of the guidebook. If you're considering a nursing home, go to Medicare's Nursing Home Compare page at medicare.gov/nursing home compare for more information. And again, the Elder Care Locator is a great resource to also find such professionals. So step 5 is caring for yourself. Don't overlook the impact of caregiving on you and the person you're planning to care for. Pay attention to your health and well-being. The best way to ensure you have the energy to care for someone is to take care of yourself. It's also the best way to help a caregiver care for you. Consider what you know you are able to do and volunteer to do just that. Know your limitations and do what is within those parameters. Also, advocate for you. The Caregiver Advise, Record, Enable, or CARE Act that passed in many states. You should consult with your loved one's doctor for training if you're expected to do complex medical tasks at home. Some additional tips for caring for yourself include tapping into resources, for yourself, such as social workers, nurses, and other professionals who can guide you through care options and help monitor the care if you don't live nearby. Using technology such as personal emergency response systems, remote monitoring devices, and mobile apps can help coordinate care. And ask your employer. Some employers offer benefits or services to support family caregivers. To those who are still working, I do encourage you to meet with your human resources person and/or the Americans with Disabilities Act representative, as they are a good source of information regarding benefits available to you. Review your own finances. It's important to calculate your caregiving-related expenses and account for them in your personal budget. Talk to your doctor and let them know you are a caregiver and discuss ways to manage stress. You also should consult with your loved one's doctor for training if you're expected to do complex medical tasks at home. Take advantage of caregiving services and support. Service and support groups can help you throughout the caregiving journey. And take a break. Make time for exercise, sleep, healthy eating, and staying connected with friends. What I was able to do for one of my daughters who at the time lived here in Massachusetts, and while I was still in Maryland, she would come down on her weeks off. And so I was able to set up a situation for her at my gym where she could come in, use the gym under my guest passes without me having to be there to sign her in. And that enabled her to kind of de-stress from her job, as well as, the task of taking care of me. And she would do it while somebody else was with me at home, either the physical therapist or a neighbor or someone. Now, we've just wrapped up the 5 steps of caregiving and care receiving, but this is just the beginning. AARP offers a variety of online information, resources, in-person events, and self-paced learning, all for caregivers. I want to be sure to mention these couple of resources you see on the screen. AARP's Caregiver Resource Center is a central hub for all things caregiving at AARP. You can read the latest articles and get tips and advice, and that's where you'll find the caregiving guide with downloadable checklists for when you need to update or revise your caregiving plan. In addition, there's a toll-free resource line noted here on the screen, and in Spanish, the number is 888-971-2013. AARP also has the AARP Learn at 50 Plus website, where you can learn about local in-person events and explore interactive educational videos and webinars on caregiving. You can also download the caregiving guide from that site also. So that's aarp.org/learn@50plus. The Community Resource Finder is where you can get easy access to resources, community programs, and services through this online community resource directory. The directory is compiled from provider descriptions and public data made possible by the Alzheimer's Association and AARP. So I hope you've enjoyed the session so far, and the information that was presented will be of value to you. It's important to prepare for our future and our own longevity so that we can live the best life possible. So now I'm going to ask you, have you thought about, one, what might you have done differently to make a plan? Or have you considered how you might start a difficult conversation? And how would you set about forming a team? So we will take any questions you have. I see there are some things in the chat, it looks like.
Yeah, so in
I don't
the
know if
chat,
people can see it. Okay.
I've added some of the resources that you mentioned, as well as some links that people can go to if they want to sign up for future webinars that we have. But if people want to put questions that they might have in the Q&A, and then I'm not sure if I'm saying your name right, but Subhadra has their name up. I'm going to allow you to talk if you'd like to ask a question. If not, you can lower the hand or just choose not to talk as well. But I've enabled it, Subhadra, so you can speak if you would like to ask the question.
She might have to take herself off mute, though.
Yeah, I've enabled it so you can take yourself off mute and ask a question if you'd like to, but if not, that's okay. You can get questions in, yeah, the chat is disabled, but we're doing the Q&A section for questions. So if you have a question, please put your questions in the Q&A. The chat is where we're putting the links for you all to see. So hopefully you're seeing that.
And just to give an example, while people might be forming questions about not having people live nearby, I have a friend who lives in Virginia, and her mother had recently been placed in a nursing home near her in Virginia. She has a sister in Ohio and a brother in California. And all three of them actively participate in caring for their mother. The brother in California handles all the paperwork, all the billing, applications, forms, anything like that. He deals with that. The sister in Ohio flies to Newport News, Virginia, about every 5 weeks or so. She takes off from work. She has like 5 days. She comes to give my friend a break so that she'll go to the nursing home, visit with mom, take her for walks, activities, etc., so that Vanessa, the friend who lives there, can have that respite. So that's what I mean about when you say even if people don't live nearby, there are still ways that they can help. And the key is to stay in contact. So they use Zoom, they use conference calls, text messaging, anytime they need to. So Subhadra, do you have a question? I see you're off mute now.
Yes. Actually, thank you very much for the presentation, first of all. The reason I really logged on is, I registered for this, is my husband and I, we live on our own. We had a child living close by, but, he's gone. And my husband fell ill for a long time, for quite some time. And that was the first time I realized that I needed to know more about caregiving. And my husband and I, he's 82, going to be 83 very soon, and I'm 75. So far, we've been very healthy. We haven't, been sick or really, but, this time he had one problem after the other. So I have spoken to my children who live, 3 or 4 hours drive away, saying that if your father continues, to fall ill, there might be a time I might need your help. And we haven't really had a formal conversation. So that's the only thing I've done. But I thought I should listen, to know,
Right. Getting them to start thinking about it, and then again you can sort of have like even a follow-up. Here's some ideas I have as to what we might need or what your father might need, even if it's kind of sort of a multi-step conversation where you're kind of discussing things a little bit at a time. I think it's much easier to do it when everybody's sort of calm and able to participate, as opposed to when something bad does happen and everybody's in that emotional and everybody's upset and there's just a lot going on and you just can't think clearly. So I think it sounds like you're on the right track to at least start communicating with your adult children and letting them know. And then the other thing you might want to do is look what's in your area. Start talking to some agencies in your area to see what's available. Like I learned where I lived at the time, which was in Columbia, Maryland, they had this place, it was almost like a library for medical equipment. And you could, so if you needed a walker, or like when I had the spinal surgery, I needed a walker, I needed this thing to reach things and to pick up things and to put my socks on and shoes. And when I went back to work, I still needed some of that. So I was able to borrow extras to take and leave at work, so I didn't have to carry it back and forth every day. And then I donated everything back to them, when I no longer needed it. So there's just so much that's available that people don't realize because you're not looking for it necessarily. But once you start looking, you're going to see. And there's lots of volunteer people who will even come and sit and have lunch, with your husband or you, so you can get a break, and or just kind of visit for a little bit, to give you that sort of respite time for yourself. So I think you sounds like you're on the right track at sort of getting things started and kind of getting your head wrapped around. I need to start planning something sooner rather than later.
Yes, thank you.
Any other questions?
If you have questions and would like to speak, I can, yep, Stephanie, I will allow you to talk. So you're welcome to unmute yourself now and ask your question.
The AARP.org has the caregivers guide. If you go there, AARP.org/caregiving, then you should start to see all of those links. And
Yeah.
Stephanie, if you just take yourself off mute.
I was only now I'm very interested in the resources. I'm in the Berkshires here, and I'm interested in those resources. My father's 94 and I came back home to be with him full time New Year's Day of 2023, but we need resources. We really do. So you're giving me direction now of
Great.
going into the community and asking, where do we get this, or how do we get that, or
right. And those councils on aging, I've given presentations at several of them around the state, and they have a great source. They're a great source of information. If they don't do it there, they can figure out who does. So definitely try to connect with them if you have one out there.
Thank you.
Stephanie, are you seeing the resources in the chat now? Just want to make sure people are seeing them. Hopefully.
Yes, I see it. Yes, I see it.
Great, great. Okay, wonderful. Wonderful. Any other questions?
I hope everybody's using time to think about what they might need to do.
Yeah, and as we mentioned, we do have 2 more webinars available. So next Thursday and the following one as well. As a reminder, for next Thursday on the 16th, it's making sense of caregiving. So that will discuss a little bit more about the financial implications and planning process. And then downsizing and decluttering is on November 30th from 7 to 8. And that will help.
The making sense of caregiving is kind of the part 2 to this presentation. So that would be great to view.
Great. Let's see, I'm just checking the chat here. There's an equipment loan program in Woburn, which loans equipment for people. That's in one of the questions. I will put that in the chat as well, so everyone can see that. There are lots of councils on aging also loan equipment and resources from.
Yeah, see, that's what I'm saying. You'd be surprised. I mean, and someone, I forgot who told me about it, but I had been living in the town for a long time and never realized it because I never needed equipment. And I thought it was just the best thing ever. It was great.
Mm-hmm. Just lots of thank yous in the Q&A.
And there's also agencies I know that Massachusetts has, where there's groups of volunteers who would, they might drive you to appointments, or like I said, they can do like a companion type of thing, where if like the first Subhadra was talking about it's just her and her husband. And, when it's just the two people and the one person's sort of that primary caregiver, you need to take a break for yourself every now and then. So if you have somebody that can come, even if it's for an hour or two, and they sit and have lunch, or, watch a movie with your husband, and you can take a walk and just, have a time to refresh and clear your head. That is a huge thing. So there are volunteer organizations that have people that will do that. And so look into those as well. I see something.
Yeah, let's see. Just a lot of thank yous. Yeah, we appreciate all the feedback, and yeah. Well, thank you so much, Teresa. It was a wonderful presentation, very informative. Appreciate you sharing your personal stories as well. I think that makes a difference for everyone to connect.
I think I developed a I don't know how you call it, like a post-trauma response to the Tonight Dough ice cream. Now my favorite is fish food. But
okay.
I think I associate it with having been sick before, so I used to love it, and now I'm like, let me, I get either the fish food or the vanilla caramel fudge. So I haven't given up the ice cream, but just changed flavors.
Love it. Love it. Well, it's nice that so many people wanted to help.
Yeah.
All right. Well, if there aren't any more questions, we really appreciate everybody attending this evening, and hope that you'll join us for another webinar. Have a good night, everybody.
Good night, everybody.
Bye.